Karanja Gathoni, 3-minute-old baby boy, born in Natharet Mission Hospital, Kiambu District, Kenya. This time Jane Gathoni doesn't have to deliver her child in the dust in front of her hut, like she did with her last son. Thanks to a new output-based aid project, OBA, she can now go to a hospital to deliver her 5th child. Since 2006, the Kenyan authorities, supported with a grant by the German government, sell vouchers for reproductive health services. With this voucher, Jane can choose any health service provider for antenatal services, medical support at delivery, and postnatal treatment. 200 Kenyan shillings, about $3 US, Jane had to pay for the voucher. She has to pick 40 kilograms of tea for that sum. We visit Jane and her family 2 days before her son's delivery. She is still working. Jane belongs to those poorest of the poor, who, in rural areas, make their living as casual workers at the tea estates or by digging on farms. 56% of Kenyans live below the poverty line. They would normally have no access to qualified medical service. The mortality of mothers is high. Every 8th child dies during delivery or within the first 5 years. At this moment, Jane makes preparation to go to the hospital for delivery. She doesn't have much to pack, just a few things, hardly anything to dress her baby in, and her own documents. She bought the Safe Motherhood voucher and intends to buy one for family planning later. For Jane, the trip to the hospital means waiting for the public bus, a matatu. If it doesn't arrive, she'll have to walk about 15 kilometers. Sometimes women go into labor before they can reach any health care. The reason that made me go for the voucher is that after my last delivery, it took me a long time to recover from the illness I got. It's taken a very long time to get the money. I had to borrow from a friend, and up to now, I haven't been able to pay back that sum. Finally, a matatu arrives, and Jane can now go to the hospital. In Kiambu District, 17 hospitals and health centers have been accredited to take part in the OBA voucher project, government, mission, and private ones. Jane arrives at the hospital of her choice, the Natharet Mission Hospital. All the service providers are reimbursed with fixed amounts for the various services, for normal delivery, cesarean, or various family planning treatments. The funds are made available through the KFW and managed by PricewaterhouseCoopers. Jane checks in for her examination. Githunguri, a small township of Kiambu District, at the main administration office for the town. Here we found the OBA field workers. Their OBA booth is located at this central place to have easy access to many women. The field workers do counseling and awareness campaigns, and during their weekly counseling hours they sell both the Safe Motherhood and family planning vouchers. Many clients have to be educated and convinced of the program. Jane also came here a few months ago and bought her voucher.